All right, in this section we'd like to demonstrate for you the actual sites for doing our epidural skin biopsies and the measurements for those sites. The potential sites in the lower extremity start with the upper thigh. Our volunteer Bob, if you wouldn't mind helping me. Thank you. We're going to measure directly from Bob's greater trochanter 10 centimeters down on the lateral aspect of the thigh for our first measurement. And that would be right here. Our next site is measured from the patient's patella, 10 centimeters up. Our lower thigh then is in that area. The lower calf area we measure directly from the ankle, and again 10 centimeters up. The important thing to remember about the lower calf area is to stay away from the direct midline. We have a tendency, if you go a little bit too deep, to hit a vein there, and it does cause excessive bleeding. So I suggest you go either a little anterior to midline or even a little posterior to midline. Both of those areas are acceptable. The foot area, we go straight between the patient's small toe and again the ankle. Midline between that for the dorsal foot would be in that area. And then finally, upper extremities, considered the lower arm. We have the patient bend their wrist, and in this one we measure exactly 5 centimeters up from the wrist. So we would be right in this area. Again, that would be on the anterior forearm, 5 centimeters up from the wrist. All right, typically if your patient has numbness bilaterally on both lower extremities, to decide which extremity you're going to do your biopsies on, some other things you might want to consider is, has the patient had any major surgery? Obviously, if they've had a major hip replacement, you don't want to do a biopsy directly below that. Major knee surgeries, you don't want to do your biopsy below that area as well. You don't want to do a biopsy over a previous biopsy or over any scar tissue or any infections.